Hello, my name is Lolly Rodriguez from Pickering Insurance Solutions. We are your broker for employee benefits coverage. We will be going over the new benefits available to you. This year, there will be a big change in your medical, dental, and vision plans. What is open enrollment? Open enrollment period, it's important to all eligible employees. During this period of time, you can make changes that you normally don't make during the year. This slide shows the list of things you can do during open enrollment. For example, you can add or remove dependents. You can change plan coverages. You can cancel some or all coverages. You can enroll in some or all coverages. How to enroll. Review your current benefit elections. Verify your personal information is correct and make changes if necessary. Elect your new benefits. Once you select your new benefits, you will not be able to change them until next open enrollment period unless you have a qualified change of status. It's mandatory that all eligible employees must log in to Paychex Flex at paychexflex.com to enroll or refuse each coverage. For those currently enrolled, you will need to log in and re-enroll. Please contact your HR department if you have any problems with your login through Paychex Flex. If you have any questions regarding your benefits, please contact our office at 800-858-1207. When to enroll. The open enrollment period runs May 1st through May 31st. The benefits you elect during open enrollment will be effective from June 1, 2020 through May 31, 2021. Deadline. You will need to complete your enrollment through Paychex Flex portal prior to May 27th. Who is eligible? If you are a new hire, you are eligible first of the month following 60 days after date of hire. All eligible employees working over 30 hours per week are eligible to enroll, decline, and or make changes during open enrollment. Please note there are some additional requirements you need to be aware of prior to adding a dependent to any of the coverages being offered. And this slide shows some requirements that are needed for you to add your dependent. What is new for 2020? ACA. The individual mandate in California has been reinstated. You will be now penalized if you don't have coverage in the year 2020 when you file your taxes in April of 2021. Your medical plan. Your medical plan is moving from Kaiser Permanente to Anthem Blue Cross. Dental plan. Moving from Guardian to Anthem Blue Cross. Your vision plan. Moving from Guardian to Anthem Blue Cross. Changes outside of open enrollment. After the open enrollment period window has closed, you cannot make any changes unless you experience a life event change. If you have a life event change, please provide the necessary proof of documents to your Human Resource Department within 30 days of the event. Health plan options. Below are some highlights for each plan option available to you. The first one is Anthem HMO Low Plan 1500. This plan has the lowest premium per pay period, being deducted from your paycheck, but has higher cost when you need care for some certain services that are subject to the deductible. It's a good choice if you want less taken from your paycheck, but also have coverage to protect yourself from any catastrophic injury or sickness. The second option Anthem HMO High Plan 2040-500. This plan has higher premiums per pay period being deducted from your paycheck, but the lowest cost when you get care. You will only be subject to pay your copay or coinsurance. It's a very good choice if you normally utilize the coverage a lot and you are willing to pay more from your paycheck, knowing nearly all other costs of care will be covered. MediExcel HMO across the border. This plan is available only across the border. We have 2 locations, Mexicali and Tijuana. This plan has the lowest premium per pay period taken from your paycheck. Also has the lowest cost for all services. It's a very good choice if you normally go across the border for care already, or if you have dependents that live in Mexico, or if you just simply prefer the Spanish language, or prefer getting care during the weekend. Medical coverage through MediExcel across the border plan. We'll be changing your medical plan effective June 1, 2020. If you see in this comparison, the first column in blue, your current plan V5. This is your current plan prior to June 1, 2020. The second column in orange, it's your new plan effective June 1. If you notice, there are some changes on your out-of-pocket max, your doctor visits, and your specialist. I highly suggest you review your benefits, and if you have any questions, please contact Pickering Insurance at 800-858-1207. For those that are new to these benefits, please note with MediExcel, the care is provided in Mexico, Tijuana, Tecate, and Mexicali. MediExcel covers emergency room and urgent care in the U.S. through CVS mini clinics and other clinics in San Isidro. MediExcel Healthcare Network has been serving the Baja California community for over 23 years with highly trained bilingual licensed physicians, state-of-the-art facilities, and the quality care that employees and dependents deserve. Dental coverage through MediExcel. Your MediExcel plan grants you access to a network of dental providers without deductibles or limited annual maximums. To schedule an appointment, including referrals for consultation and emergency services, contact the MediExcel member line, or you can go to MediExcel.com for additional information and locations. You can also download the app MediExcel, and you can make your appointment through your mobile app. Vision coverage through MediExcel. Vision services are available at MediExcel facilities with no out-of-network coverage. All services are covered only across the border in a MediExcel facility. To find providers or locations, go online to MediExcel.com. Additional resources through MediExcel when you enroll in the MediExcel medical plan. MediExcel offers you 3 programs available to you. The first one is Call the Doctor line. If you are unable to see your provider and cross the border to make that appointment, you can always call the doctor line and go over your symptoms or prescriptions or any questions that you may have. The second program is the Urgent Care Mini Clinics in the U.S. MediExcel has 58 mini clinic urgent care facilities inside select CVS store pharmacies throughout California. please visit the CVS website for store locator. You can also download the CVS mobile app to find out the wait time for care. Please note there's no appointment necessary. The last program is called HEAL program. Members have access to an urgent care doctor in the comfort of their own home or office. Through a partnership with HEAL, members can schedule on-demand urgent care house or office calls within a 2-hour window, 7 days a week between 8 a.m. and 8 p.m. Your cost per pay period in 2020. This is a comparison of the cost from your current to your new plan starting June 1. You can see in this comparison your Kaiser HMO Low, your Kaiser HMO High, and the MediExcel V5 versus your new plans. As you can see, for 2020, your cost will actually go down. If you have any questions regarding your deductions, please contact your Human Resource Department. Regarding your deductions, this is your deductions for your dental and vision. Again, same as the medical. This is a comparison between your current versus your new deductions starting June 1. Again, we are moving from Guardian, dental and vision to Anthem for dental and vision. MediExcel, dental and vision, cost will remain the same. Your Mutual Omaha rates, please refer to your employee booklet or Paychex Flex website for individual rates based on your age and salary. Questions. Please direct all questions regarding your employee benefits to Missy Coates and Sarah Rogers. In addition, you can always call Pickering Insurance Solutions for any questions regarding your benefits. You can ask for Lolly Rodriguez or Shannon Gann. Thank you for your time. This presentation has been brought to you by Pickering Insurance Solutions.
Hello, my name is Kathy Simpson, and I will be going over the presentation today of your new benefits. I hope this will assist you on which plan to choose and which plan is right for you and your family. Welcome to Anthem Blue Cross. There are 2 plans to choose from that utilize our Select HMO network. You'll need to choose a PCP for each member of your family within 15 miles or 30 minutes from your work or home address. Your PCP is considered the gatekeeper for your care and is the first place to call when you need services for non-urgent or emergent care. When you need to see a specialist, they will refer you to a specialist within your medical group. There is no coverage for out-of-network providers unless it's an emergency. Your out-of-pocket maximum per year is $2,500 for one person or $5,000 combined for you and your family. Your PCP copay is $20 and the specialist copay is $40. If you need treatment quickly or outside of your doctor's normal hours, knowing where to get that treatment can help you save money. So if it's not a medical emergency, try these other choices. Retail health clinic, a clinic staffed by medical professionals who provide basic medical services to walk-in patients like a CVS Minute Clinic. The copay is $20. Urgent Care Center, a group of doctors who treat conditions that should be looked at right away but aren't as severe as emergencies. They can often do x-rays, lab tests, and stitches. The Urgent Care Center must be affiliated with your medical group, so you will need to know which ones you can go to prior to receiving services. Check with your PCP's office. The copay is $20. Emergency room. If you seek services at the ER, it's a $100 copay, and if you are admitted to the hospital, then the copay is waived. Ambulance. This is a $100 copay per ride by ground or air. Chiropractic and acupuncture rider. Both are offered on the 20/40/500 plan, but only chiropractic rider is covered on the $1,500 plan. You can self-refer to the providers in the Anthem network without a PCP referral. It's a $10 copay, and you get 30 visits per year. Please refer to your Anthem plan summary for more coverage details. Pharmacy coverage. Anthem contracts with hundreds of major chain pharmacies such as CVS, Walgreens, Save-On, and smaller chain stores as well. You can locate a list of pharmacies in your member portal or our Sydney app. Prescriptions are listed by tiers, and the lowest cost drugs are generics. For retail's tier 1A and B will be the most cost-effective drugs. Copays are $5 for 1A tier and $15 for 1B tier. Tier 2 drugs are low-cost brand name drugs at a $30 copay. Tier 3 drugs are higher cost and considered non-preferred drugs. These drugs are generally newly FDA approved and are not on our formulary list, so your physician will need to contact Anthem to get prior authorization to get them approved. Tier 4 drugs are mainly specialty drugs, and you would pay a coinsurance of 30% up to the maximum amount of $250. For the 20/40/500 plan, there is no pharmacy deductible. But for the 1500 25/50 plan, there's a deductible to meet for tiers 2, 3, and 4. Please make sure to fill your current prescriptions prior to July 1st to make sure you have enough on hand until you receive your Anthem ID card. Please refer to your Anthem plan summary for more coverage details. Once you're enrolled, please register on the Anthem member portal at www.anthem.com/CA or our Sydney app so you can see your plan details, find pharmacies, request home delivery medications, and view the essential formulary drug list. If you're taking a non-formulary drug that's not on the essential drug list, please contact your doctor so he or she can contact Anthem Blue Cross and request prior authorization for approval. For questions related to any of this information, please contact IngenioRx, whose number will be listed on the back of your ID card. IngenioRx is a wholly owned subsidiary of Anthem Blue Cross. How to find a provider. Anthem contracts with what we call medical groups. One model is called a PMG, or participating medical group, where all of the doctors generally work in the same building. You can search for this type of model in our Find a Doc site by searching either by a doctor's name or key in the medical group specialty in the search criteria, and then IPA PMG medical group. The PCP ID will be a 3-digit code. We also contract with IPAs or independent practice associates, and these will be doctors that are considered a medical group, but they work in their own offices. Search under Doctor Medical Professional and all specialties. Their PCP IDs will be 6 digits. You can choose a different PCP or medical group for you and your family, and you can change your PCP anytime during the year by calling member services. You cannot change the medical group or PMG mid-year if you're in a course of treatment. Dental Essential Low Plan. Along with your Anthem medical plans, you will be able to elect between 2 dental plans and select Anthem Blue View Vision, which means only 1 member card. First, let us take a look at your Dental Essential Low Dental Plan. This plan has both in and out of network calendar year maximum benefit of $3,000. Your orthodontic benefit has a maximum $1,000 lifetime maximum. This plan has a carryover benefit, which I will address in another slide. Your deductible for basic and major services is $50 for an individual with a 3 times family max. Your diagnostic and preventive services are covered at 100% with no deductible. And if you are pregnant or diabetic, you have a third cleaning at 100% coverage. Basic services such as fillings, deep cleanings, and root canals are considered basic services and covered at 100%, but you must first meet the deductible. Major services such as crowns and implants are covered at 60%. Only children are covered for orthodontia, and it's at 50% to that lifetime maximum of $1,000. The high plan has the same number of providers as the low plan. The high plan has the same maximum benefit, orthodontic maximum, along with the same carryover benefit. It covers less than the low plan for basic services and major services, and as the low plan will only cover children for orthodontia. Why then is it considered a high plan? Because if you go to a non-contracted dental provider, we will pay that provider at a higher level than what they would have received on the low plan. If your provider is not part of the Anthem Dental Complete Network and you wish to continue with that provider, you will have less to pay out of your pocket. Both the high and low dental plans have what we call a carryover feature, and it works like this. You must see a dentist at least once during the calendar year. We want you to make sure you have your preventive exam and cleaning done. During the calendar year, if your claims don't add to more than $500, you can carry over $250 to January 1st of the next year. Every year that you meet this criteria, you will have a $250 carried over to a maximum of $1,000 during any 6-year period. If you currently have a balance with your Hollandia dental provider, we will credit that amount on your Anthem dental benefit. Ask a hygienist. You can get an extra hand from Ask a Hygienist. Here's an example question. My wisdom teeth are impacted and starting to move my front teeth. Can I see an oral surgeon for this? Who do you recommend that is in network and close to my zip code? You will be able to find the link on your anthem.com/CA website. Dental Cost Estimator. Cost is an important part when seeking dental care. Through our Dental Cost Estimator, you can compare costs between in-network providers and look at estimates for common dental procedures. If you're facing an extensive course of treatment, don't forget to ask your provider to get a predetermination from Anthem to know exactly what will be covered. You can connect with a dentist anytime, anywhere with teledentistry. You would just log into anthem.com/CA or through the Sydney Health app. On the main page, select Find Care, look for a dental professional, and select the link for the teledentist. You will be taken to that website where you will be taken to a virtual waiting room. You'll answer some questions just like you would in a dentist office, and you will then be connected with a licensed dentist for a virtual visit in as little as 5 minutes. Mexico Dental Network. Many who live in Southern California sometimes seek services in Mexico. The Dental Complete Network is so large, we even have contracted providers in Mexico. Blue View Vision Coverage. Your Blue View Vision benefits also began on June 1, 2020. Eye exams once a year are just $10. Your standard plastic lenses are just $25 once a year, and you receive a $130 allowance for your frames once every 2 years, with a 20% discount for frames over the $130 allowance. If you wish contact lenses, you would receive a $130 allowance instead of frames and lenses. These are all your rich in-network benefits. If you wish to visit a non-contracting provider, you would still receive benefits, but only to the reimbursements shown on the slide. With access to more than 38,000 doctors at more than 27,000 locations across the country, Blue View Vision makes it easy for you to get to your annual eye exam. In fact, your plan includes places like Lens Crafters and Target Optical, which are open late and on the weekend. and you'll receive the industry's best discounts with reduced out-of-pocket costs on lens options and laser vision correction surgery, and 40% off additional pairs of glasses from stores in your plan. Blue View Vision has thousands of contracted providers throughout the United States. To look up Anthem providers within the United States, go to our provider finder under www.anthem.com/CA. For dentists, look under the Dental Complete Network, and for vision, choose Blue View Vision. Live Health Online is a quick, easy way to see a doctor or a therapist through a private video visit using your smartphone, tablet, or computer. You can be at home or even on vacation. All you need to do is register at livehealthonline.com or download the free app to get started, and you will need to type in your Anthem ID number and your credit card information. With Live Health Online, you can have 24 access to doctors in about 10 minutes or less. Doctors can assess your condition and send prescriptions to your pharmacy. If needed, it's a great choice when your doctor isn't available for things like pink eye, the flu, a cold, a sinus infection, and even COVID-19, and much more. The charge for the doctor visit is a $10 copay. The 24/7 nurse line is available around the clock via a toll-free number and provides registered nurses who will talk with you about your general health issues. They can help you determine if you can treat your issue at home, if you need to make an appointment to see a doctor, or if you should head to urgent care or the emergency room. The toll-free number is listed on the back of your ID card. Future Moms is a free program that offers helpful tools and resources during your pregnancy. The toll-free number connects you to a nurse coach 24/7, and you receive the Your Pregnancy Week by Week book. Get screenings for risk or depression or early delivery. There's lactation counseling services as well. ConditionCare. If you or a family member has asthma, diabetes, heart disease, or COPD, or certain other conditions, a ConditionCare nurse coach can help you manage your health and follow your doctor's care plan. In ConditionCare, you work with dietitians, health educators, and pharmacists to reach your health goals. There is no cost for you to use this program. The Sydney app is everything you need to know about your benefits, all personalized in one place, and is built using AI or artificial intelligence. You can find care, check costs, view claims, view your digital ID card, and has an interactive chat feature. Just download the app, create a username and password, and search for doctors, urgent care centers, and access your ID card. If you're already registered on a PC or a laptop at www.anthem.com/CA, in the member portal, you can use the same username and password for the Sydney app. Special offers. Save money on things that are good for you. Get discounts on things like vision, hearing products, health and fitness services, gym discounts. You can also save money on services and products for your family and home, and some medicines and treatments. To find discounts that are available to you, log into your member portal or the Sydney app. Get Strong is an initiative that Anthem has to provide you with an opportunity to earn up to $200 for completing wellness activities as an incentive to make healthy choices. Completing your tobacco-free certification earns you $50. Completing your health assessment earns you $50. And a flu shot plus a wellness visit earns you another $100. After you complete your first activity, a reloadable debit card is issued that you can use wherever major credit cards are accepted. In addition, you will also have access to your own wellness coach. You can track your activity by visiting www.anthem.com or via the Sydney mobile app. Health Rewards Card is a reloadable rewards card that can be used anywhere major credit cards are accepted. As you earn rewards, they will automatically be deposited into your rewards account and available to spend using your health rewards card. This card can be used everywhere that debit MasterCard, Mastro, and NYCE cards are accepted. This card cannot be used at any ATM or to obtain cash. When a member completes their first health rewards activity, fulfillment of a health rewards card will automatically be triggered. Members will receive their health rewards card within 12 to 20 business days after completing a health rewards activity. Members must hold on to their health rewards card. They only get one. If their card is lost or stolen, members can request a replacement card on the Anthem Health Rewards website. Health reward cards are valid for 3 years. As members complete additional health rewards activities, reward dollars will be automatically deposited into their rewards account and available to spend using their health rewards card. Note, 90 days after termination of medical eligibility, a member's health rewards card will be deactivated and the remaining balance will be mailed to the address on file. This concludes my presentation today. Thank you for taking the time to learn about your benefit offerings. Remember, we are here to help if you have any questions, and please remember to download the Sydney app as soon as possible once you're enrolled and get your ID card. Thank you and have a great day.
Thank you for taking the time to review your Mutual of Omaha benefits. As an eligible employee, you have the opportunity to enroll in valuable insurance coverage. In this online overview, we will highlight the insurance options that are available through Mutual of Omaha. There are no changes to the Mutual of Omaha plans. Your employer provides life insurance for you at no cost. You are automatically covered for $10,000 of life insurance. Voluntary life insurance is available. It is the additional life insurance you can elect separate from the company paid benefit. If you are a new hire during this open enrollment, you can sign up for voluntary life insurance without answering medical questions up to the guarantee issue amount. If you're not a new hire and enrolling for the first time, you must complete a health questionnaire. The minimum amount you can elect for yourself is $10,000, for your spouse $5,000, and for your children $10,000. Children are covered up to the age of 26. The guarantee issue amount that you can elect is $110,000. For your spouse, $25,000, and for your children, $10,000. The maximum amount you can elect is 5 times your annual salary, up to $500,000. Your spouse, $250,000, and your children up to $10,000. This is all subject to underwriting approval. In order to purchase life insurance for any dependents, you must select coverage for yourself. If you are currently enrolled in the voluntary life insurance, you can increase by $10,000 during this open enrollment without providing any medical questions. Disability insurance is a way to protect your income. If you're unable to come to work as a result of an accident or sickness, disability insurance will pay you a benefit. Your benefits will begin on the 8th day of your injury or illness. Benefit amount is 20% of your weekly earnings, not to exceed the maximum of $1,500 a week. Your benefits will be payable for a maximum of 51 weeks. If you're enrolling for the first time, disabilities that occur during the first 6 months of coverage due to a pre-existing condition will not be covered. Long-term disability benefits pay out after short-term disability ends. They pay after 365 days, and it'll pay 60% of your monthly salary to a maximum of $6,000. It pays up until Social Security normal retirement age. If you're enrolling for the first time, there is a health questionnaire you would have to fill out unless you're a new hire. The accident insurance policy pays you for any type of injury that you or your insured family member sustain as a result of an accident. During this open enrollment, you can elect the benefit for yourself and your family. The accident insurance pays you specific amounts for every type of service rendered to you or your enrolled family member due to an accident. The plan covers a variety of services like emergency room visits, urgent care visits, fractures, dislocations, burns, hospital confinement, physician follow-up visits, and therapy services. Critical illness insurance provides a lump sum cash benefit upon diagnosis of a critical illness. If you're enrolling for the first time, you must fill out a health questionnaire unless you're a new hire. The plan is available for you and your family. The critical illness plan pays out if you're diagnosed with heart conditions, organ failure, and/or cancer. Some childhood or developmental conditions are also covered. As a new hire, you can purchase up to $10,000 of critical illness insurance for yourself. Any amount over the $10,000 will require a health questionnaire. You may also purchase $10,000 for your spouse and $5,000 for your children. The maximum amount of benefit you can purchase is $20,000 for you, $20,000 for your spouse, and $5,000 for your children. When you enroll in this benefit, your children are covered up to the age of 26, and you do not have to pay premiums for them. If you're not a new hire, a health questionnaire will be required. Once again, there are no changes to your Mutual of Omaha plans. This was an overview of your benefits. Please refer to your plan summaries for details. Thanks again for taking the time to review your benefits.